Hi, that would be me.
Yeah.
Um, I'll just start sharing my screen now. All right, hello. Today I'm going to be talking about nanotechnology and its implications on revolutionizing medicine. So first of all, I'd like to start with a little bit of an anecdote. I think I told Dr. Soles this when I was interviewing to get into this course. I read this story when I was about, I think, maybe 10. And it was like what, written maybe 30, 40 years ago. And I just wanted to maybe demonstrate the climate about what I want to be talking about. Even back then, this was the view. It was about just a society where people had nanotechnology implemented within them. It was like a fusion, kind of like Ray Kurzweil's vision, which I'll be discussing a little bit later. And basically, no one can get hurt because anytime any damage would occur, these nanorobots would immediately fix it. And it caused this absolutely distressing world where people are getting super depressed because, well, there's really no purpose in life. You know, they can't hurt themselves. Killing oneself was extremely difficult. And so, and people really didn't have any forms of entertainment. Nothing was risk taking, nothing was exciting anymore. And then this game show came out where this scientist invented kind of a chair where the participant would sit down, answer a couple of questions. If they got a question wrong, it would be kind of like a Russian roulette for one of their vital organs that would be destroyed. And that show is pretty much the most exciting thing that happened to the world since those nanotechnology were introduced. And it's a really cool story. Basically, the scientist ends up dying because he gets put on the chair to increase those levels of entertainment. And they ask him about the name of the first contestant, and he couldn't remember it. Either way, this was maybe written like what, 30 years ago, and it just visualized this dystopian vision of a nanotechnological fusion with the human body. And I think nowadays we can safely say that that's probably not going to happen, and discuss the other implications that might occur. So today's talking points are going to be about the current research and application of nanotechnology, future predictions of nanotech, ethical and social implications and dilemmas, and a discussion and a Q&A. So for the current research, there's so much to talk about. I could never condense it into one presentation, so I just picked out the most exciting ones that I could find. So the first one we'll be talking about is chemotherapy. So chemotherapy was introduced in the 1940s as a standard clinical practice to treat cancer. And even though it's 80 years later, the side effects are still pretty prominent. People get hair loss, memory deficits, concentration problems, fatigue, anemia, etc. So then researchers at the National Cancer Institute came up with this device, this nanoparticle, that packaged TNF-alpha. TNF-alpha is a cytotoxic agent that stands for tumor necrosis factor alpha. When it's packaged inside these nanoparticles, the nanoparticles are then coated with gold, like pure gold. They're injected in your system. They pass by through your blood vessels without any problems. Your immune system doesn't attack them. They're deposited at the tumor site where the TNF-alpha is released. And they actually found that the TNF-alpha does not affect the adjacent healthy tissue, which happens a lot with chemotherapy. It actually just affects the tumor. And so that was extremely a breakthrough invention. Cytomune Sciences has been actually proposed a drug for this called Site 6091, and it's actually proven to be successful in mitigating tumor growth, inhibiting growth, and reducing metastasis. And they just passed, I'm pretty sure, their phase 1 trials of the drug. So they're going to be going on to continue testing the drug in clinical trials. Another one of these applications is cardiovascular disease. Researchers at MIT and the Harvard School of Medicine discovered that if you take this one nanoparticle and you coat it with a type of protein, they call them nanoburs. These nanoburs basically are attracted to damaged arteries. They look for something called the basement membrane inside your arterial wall, which is only exposed if your artery is damaged. So then the nanoparticles, or the nanoburs. They attach themselves into this, excuse me, basement wall, and they deposit an anti-scarring drug called paclitaxel, or the clinical name is Taxol, and it prevents any cell division and blocks scar tissue growth so that the artery doesn't actually get blocked from any scar tissue. Another one of those applications is preventative healthcare. I'm pretty sure Thomas mentioned this in his presentation for the first time, but this talks about cell senescence and aging. So cell senescence is programmed cell death. It just does so because the body wants to prevent injury to adjacent cells. Usually, the body also clears these pretty quickly. However, when the body ages, the senescent cells tend to accumulate in the body, which cause a cascade of inflammatory response. So in order to fight that, a team of Spanish scientists led by Jose Ramon Maria came up with this one nanoparticle. It's a oligosaccharide-coated mesoporous silica nanoparticle, and it targets this one enzyme that's released by senescent cells called beta-galactosidase. And so it's extremely targeted drug delivery. They find these cells and they clear them, and they actually have shown that it shows like a marked improvement in effects of aging and aging phenotypes. So moving on to future applications of nanotechnology. These are all somewhat theoretical. Some have been invented, some have been employed, but overall they're still pretty theoretical. It's in the works. There's this thing called the pill cam. It's like a sensory camera. You swallow it, and then it allows doctors and physicians to see inside of you in order to come up with a better healthcare plan for you. It was actually approved like 20 years ago, and they're still in the process of optimizing it. Another one of these inventions is something called the vibrant capsule, which is kind of self-explanatory. It just vibrates, so it's a physical laxative rather than a chemical laxative. Another one is, this one's really interesting to me, is a dose tracking pill. This one has like a sensor that's relayed usually through a lanyard that the patient wears, and it sends a notification to themselves and their caring physician. It's extremely new, and actually, I'm going to talk about this too. The FDA approved one of these, but not for just like a dose tracking pill. It's just a dose tracking pill. This one can actually release medication in controlled amounts, should you design it to do so. The one that was approved does not, because it gets into ethical dilemmas, which I'll be discussing later under the ethical section. Another one of these, which is kind of prevalent now, are nanopatch vaccines. These vaccines would eliminate a huge problem with refrigeration, storage, and administration of these vaccines. It would be like given through silicone microneedles, and it will offer pain-free method, and you wouldn't need as much of the vaccine to actually produce the same effect. So it would theoretically lessen maybe the side effects of vaccines that are common, so like a fever, like a sore arm. So in terms of the long-term futuristic visions, it's worthwhile to take a note at Ray Kurzweil's vision. He says that it's radical life extension, and the full realization of nanobots will basically eliminate biological disease and aging. I think we'll see a widespread use in 20 years of nanotech devices that perform certain functions for us. In 30 or 40 years, we will overcome disease and aging. The nanobots will scout out organs and cells that need repairs and simply fix them. It will lead to profound extensions of our health and longevity. Now, while this sounds like an absolutely outlandish vision, like we're probably definitely not going to be immortal by 2040, the groundwork is actually there. You think about it, something like a senescent cell, if you can clear that away, you can reduce the aging phenotypes quite a lot, and maybe you can actually just stop them from aging, period. And like the singularity is coming, so this might actually be an option. So now, ethical and societal considerations of advancing nanotech. There's a new emerging field of nanotech called nanoethics, but the question begs to be answered, is this really necessary? There's a law professor called Roger Brownsworth that thinks that this shouldn't be a thing, that all of the ethical considerations that should be asked, we already have, and we can just apply to the new nanotechnology. So ethical questions that probably should be addressed are these following. It's like, what specific field in nanotechnology should be assessed? What are the objectives of the specific field of nanotechnology? Are these objectives ethically desirable, and will further development of the field of research contribute to the realization of these objectives? What are the ethical problems connected with further development of the field of research, and are these ethical problems surmountable? Even though these aren't actually the standard ethical procedure for every nanotechnology out there, these are definitely questions that should be addressed when considering emerging technologies. Now, caveats with these are the fact that we don't really know the long-term impacts because we haven't implemented these nanotechnology devices yet. So for the dose tracking pills that I previously mentioned, they usually last in a patient's stomach for about a month. What if the patient wants to revoke consent for medication administered at an automatic rate? Then can they just remove it from their system? There's a problem there because the patient doesn't have full autonomy of their own body. Whether, for example, when you're taking oral medication, you can just stop taking it. So in 2019, the first smart pill was approved by the FDA. A company called eTechRx secured this approval, and it was only a sensory pill that's ingested and also functional for about a month, and it just analyzes drug levels and dosage ingested by the patients, sends the notification by the lanyard to the patient and their physician, and it's only sensory and it doesn't release any medication. So this bypasses a lot of the issues with the consent problem that we talked about before, because then the patient still chooses to take their medication at their own discretion. They're just monitoring their dosage levels. Is this ethical? Factors to consider is, well, the app can be hacked. Do medical insurance companies have unlimited access to this information? In the United States, studies suggest that up to 50% of the patients do not follow through with the whole course of treatment and do not refill their prescription, for example. So this costs medical insurance companies billions of dollars every year because they keep returning to the doctor. In Canada, healthcare costs increase when patients return to medical care centers and doctors for symptomology solvable just by taking their medication. If medical insurance companies did, however, have access to this information, would patients then feel coerced into taking their medication to avoid higher insurance premiums? These are all questions that should be asked. So to revisit Ray Kurzweil's vision, he envisions immortality in 2040. The public, however, seems to completely lean away from this. In a 2016 survey done by the Pew Research Center in the United States, about 55% did not want nanotechnology to emerge and did not want a fusion of the human body with nanotechnology, citing two main concerns: that this technology will strip us of our humanity, and that this technology will make us obsolete. It's sort of like AI. However, the latter doesn't really apply in terms of nanotechnology, but it should definitely be mentioned. When we think about the advantageous impacts of nanotech, we think about economic flourishing. The industry is expected to grow by 28% annually, and next year it's expected to exceed about $3 billion in value. There's obviously also improved patient quality of life when you remove factors like disease, like aging. Patients generally have a better quality of life. So for that survey, revisiting it again, there's divided public opinion. However, there was one extremely interesting observation that was noted. When asked about if Americans were in favor of research to provide patients with vision deficits or blind patients with artificial sights, a strong and overwhelming majority agreed. So now this begs the question, are people more okay with just eliminating disease rather than human enhancement? So since one of these goals of the nanotechnology is just treating human disease and also human enhancement, where's the line that divides the public? And it seems to be that this line is when it comes to human enhancement. People avoid playing God. They just want to eliminate the disabilities and give everyone sort of an equal playing field. So in conclusion, I'm pretty sure I think that nanotechnology is kind of a double-edged sword. There's a fine line between human enhancement and just treating disabilities and disease that needs to be regulated. So such a framework needs to be established, and I think it has to be established globally in order to sort of even the playing field among everyone. The nanotechnology has completely advanced, and perhaps in like what 2040, like Ray Kurzweil envisions, we'll actually be immortal, and we'll look back on this time of doubt and just think that our highest imagination that was seen in blockbuster films actually came true. So let's discuss. Does anybody have any opinions on nanotech they would like to share?
I just have a quick question.
Mm-hmm.
I'm not sure if you know, it's totally okay if you don't, but that approved smart pill, like how does it send information? Like how does it collect and send information to the wearable?
Bluetooth, via Bluetooth. The lanyard is connected via Bluetooth, and then that signal is also then transmitted via Bluetooth to your phone and to the physician's office.
So since the pill does expire at some point, is the like how small is that circuitry? Like does that not affect the human body once it gets dissolved in a way?
I don't think so. I don't think it's going to be harmful. I think it just can pass through the system organically once it's expired, but I'm not actually sure.
So why don't you unshare so that on the recording we can see everybody speaking? Yeah.
How do I do so? Sorry, just give me a second. Stop share.
Yay. Okay. There we are. Okay, what other comments, questions, debate?
I was just thinking, so does nanotech and using it make us cyborgs in effect, or is it just too insignificant and too small and too behind the scenes for, it to change us so drastically?
Well, right now, the nanotechnology is just completely small, and it's kind of like you said, like an insignificant background thing. However, eventually the goal is to completely physiologically replace a lot of the human blood, vital organs, everything, just so that we can sort of eliminate all possibility of disease and aging. For now, the current research is just that it's tiny and significant. We'll just monitor in the background, but hopefully maybe one day we'll have artificial blood, artificial organs. We can transcend our human bodies in a way.
I guess a follow-up question, something I came across was that sort of gray goo projection of the future if nanotechnology takes over and, we're unable to do anything about it because, that everybody has nanotech. What do you think about these sorts of very worst case scenario projections?
Honestly, I think I tend to agree with Ray Kurzweil in that, like, the definition of human beings is that we're adaptable and dynamic. I think that if we just move over from the definition of that human beings need to be this physiological organic being, then we can just adapt into our new artificial being and just realize that it avoids so much of the suffering that we go through because our bodies will eventually degrade. But I guess like maybe in a worst case projection scenario, then that story that I read about might become true. That would kind of be cool. I'm not gonna lie. Just watching the world implode in a way.
So what Rich Sutton says is we get what we deserve, that like if humanity gets stuck, if like our biological beings are not able to make progress for some reason, and the kind of the machine beings around us continue to improve, that's something that in a sense we kind of deserve because we weren't able to figure out how we could keep making progress, right? And like this idea of culture becoming richer, that really requires biological bodies, if it's the kind of culture we have now, right? So, I mean, and why can't we succeed at that? I think we can, probably can. There are very few people planning at the moment how to make human culture richer, but isn't that like a cool goal to shoot for, right? And then that kind of puts nanotech in a kind of perspective that yes, these little machines inside us are, helping us, but they are incapable of these rich sensory experiences that we as biological beings can have, particularly now with all the added intellect from, machines and so on. So I think, we're not just passive victims of the future. We can help shape it and figure out what should we be aiming for, right? What should be, what is the end goal we're trying to, achieve?
Honestly, I think that nanotechnology in the future is kind of going to be analogous to maybe the microorganisms that we already have now. So like, I don't know, for example, in our gut microbiota, we have a ton of bacteria and other microorganisms that help us out. I think maybe nanotechnology will take on that role, except it'll be so much more efficient and so essentially just faultless, so that we don't have to suffer natural human degradation over a long period of time.
Yeah. And it will improve us beyond what we would be able to be as just, biological beings. Yeah.
Thank you.
All right. So now some of you wanted to talk about multiple instances of self. I wanted to point out, just like we're just talking about nanobots making us better than we could ever be with just our basic biology, that video of mine of multiple instances of self is better than anything I could ever do without animator Molly Little. It's a lot more amusing and a lot more watchable than it was before we added her animations. So I recommend that video very highly, but the best part is sort of her part. And that creativity is totally hers. I didn't tell her which images to use or where to put them or whatever. But it kind of increases the value of the video to you beyond the basic background of what's there. And gives you the idea. It's sort of hard to define. First of all, what would life be like if we actually had the intellect to keep track of multiple lives at once, not to get them mixed up, right? But on the other hand, if you think about having a lot of extra intellect, what else would you use it for? I mean, suppose that you were suddenly 3 times smarter than you are now. What would you do with that? How would your life be different? If there's just one of you, it might not really make much difference. Maybe it would just be frustrating because the depth of your understanding of life would be so much greater, but the actual stuff you were doing remains the same, right? I never knew how, limited my life is, but now that I'm so much smarter, I can see all the things that I'm lacking and so on, right? So, yeah, but if you then say, well, okay, what we're going to do is make sure that every life experience I want to have, I can have, even ones that would need to be simultaneous and in different physical locations. I can now do all that and keep it all straight. And so, yeah, Tien, I think that's one of the things you wanted to talk about, right? Is what would the relationship between the various instances be? And would they all share a common consciousness, or would they be independent during the day? It's only when they get together for this wonderful party at night where they're all so compatible that yeah. So how do you see it going, or what would be ideal?
Okay, so I have a very quantum-based understanding of consciousness. So when I first heard about this multiple instances thing, it instantly reminded me of some literature back in 2012 where they were theorizing how a teleporter would work, in which someone would walk in, they would literally be killed on the spot, but their exact replica would emerge on the other side. How can you be certain that you didn't just die and some clone just replaced you on the other side, free to fulfill whatever instance of their quantum consciousness pervades them? Let's say they were going there and there was like an 80% chance that your mission was to do something, but then there was also that 20% chance you do something else. What if the guy just decides not to do it or does something else, right? Like, it's very hard to say that that entity and that lived experience will be contiguous amongst two different like individuals. And so for the idea of multiple instances,
you're Canadian, right? Canadians can change their mind. You can already in a single day just wake up and say, okay, I'm going to do everything completely different now. You know, like it isn't very common to do that, but you have the freedom to do it. And you'd be surprised. Some human beings in Canada living very turbulent lives do change up things fairly frequently, you know. So so I'm not sure that they're so absolutely different. If the new copy of you is pretty much identical to the old copy that just died, and if the thought patterns are sort of maintained, then I don't know if that new instance of you decides to do something different. Is that different from you yourself just deciding to change big things in your life, right? So
yeah. So just to expand on that point, what I mean at the end of the day is it's hard to think about if that lived conscious experience is something that you would be having, or if it's just two copies, or I mean, using quantum terminology, like viewed instances of uncertainty will appear differently, even if it's based off of the same matter, the same properties. If you view it at this time versus viewing it another time, it could be completely different, even if they are the same thing. And so you have multiple instances, you know, let's say one goes to study and you stay home and watch TV. How do you know that you're getting this studied information given to you, unless there is some form of direct communication or link between your brains? In that case, it could be with anyone, right? Like, it doesn't have to be a direct clone of you. And an extension, is that the best way to do that? Wouldn't there be a better application for achieving those means rather than creating a whole other entity in itself?
see, I don't have any one specific protocol that I think should be followed. I mean, in fact, if you think about what we did in making the cutouts, it was kind of interesting and self-organizing how that worked. Think, okay, you're taking this course, and one of the students involved with the course, Ching-Yin Wong from the University of Montreal, suggests that every student get this coroplast cutout of themselves, right? Well, there needs to be photography. How is that going to be done? And so on. What was sort of interesting about it would have been a bit creepy if it had been just me and the person that I'm photographing, and we're in my 4-car garage. It's kind of, I don't know, but that isn't what happened. like the medical students involved were there throughout, right? And actually Simon Wu for the women took most of the pictures. So it wasn't me taking the pictures, it was him. And it just all happened organically, but it was very comfortable from that point of view. There wasn't a feeling of possible, exploitation or something. That's how we felt about it. How did the external world feel? Well, my boss, when he saw the first cutout, he was so suspicious that the students were being exploited and so on. So we went through this big thing of what the consent form should look like, and there are two different forms. One, if your cutout is only like for you and your mother and that sort of thing, is not for public space, or the other, if it's going to be in AHS and U Alberta public space, right? And actually, I realized the people who felt most strongly about that were not students in the course, just other people watching what we were doing, So even that, the way that unfolded, there were many accidental points in what we did. And the reason that's important is I think it's kind of a metaphor for, okay, when we get to a point where it's actually able to make multiple instances of self, what should their characteristics be? How should they be made? Should you make 5 at once, or are they always sequential? Can they converge back to one again, or do they stay separate for the rest of eternity? How does it work? And I think we didn't make any assumptions about that. In the video that I did, I pointed out that what you see on the upload program, if you watch that series, it's kind of unsatisfying. Nobody important has multiple instances of self. It's just service people, like waiters and janitors, that sort of thing. And they blur out the actual process of one person going to several. So you can't really see exactly what's happening. And it's not like mitosis or meiosis or something, it has regular stages. It just sort of, there's one person and they blur it out, and then there are multiple copies. And then there are numerous music videos, and it seems to be that without any musician saying so, every, pop musician or rock musician has gotten the idea that the cool way to do music videos now is to have multiple instances of self at some point in the video. And so, and when you look at the text on YouTube, I give all the links there, and maybe Leonard Cohen's first We Take Manhattan is maybe the first instance of a music video like that. And it seems kind of consequential because there's him and Jennifer Warrens walking to the seashore water's edge with this handcuffed briefcase that obviously has like the nuclear bomb codes or something. And then there are multiple pairs of Leonards and Jennifer suddenly. And then they all sort of go in different directions later. So I didn't assume any one particular, trajectory for what these multiple instances would do, or what they would be like, or how much physicality they might or might not have. I think you can leave all that open. So, Tien, what would you do? Do you think, does the quantum world allow all those different possibilities, or does the quantum world only allow one kind of multiple instances of self?
Okay, so I know this is really, really far out, and by all
I
means,
know.
I'm just a third year student. Okay, I don't know the answers to everything, but I mean, here's my hot take, I guess.
Right.
So consciousness, we know so little about consciousness. I honestly don't think it just resides in physical matter. Like it's just in the brain. You know, with all of this technology that's been dismantling our current understanding of consciousness, I feel it's, again, I'm not attacking anyone's presentation or shutting down the developments of like mind uploading or anything like that. I just view consciousness as something that we don't understand that much about yet. And given the uncertainty of it, extending that to multiple instances, I guess I'll rewind a bit. So I view consciousness as, or just your being, your lived experience as like this 4-dimensional shape in time. And so you can take whatever directory you want. There's like a state space for basically everything you could have done, you could have felt, you could have been, all of that. And throughout the course of time, you define that shape. And so just let's say on a 3-dimensional by a 4D axis of time, you would take up this shape. And so if you make another instance of yourself, it could be either the exact same shape or a little bit different or something completely different. Either way, it would be, again, viewing an uncertainty, which will make it into a state that isn't guaranteed to be where it started from. And so you don't have agency over it. That's the message at the end of the day. If you were to make an instance of yourself, it would be like having a child or even just creating life from something. You can't exercise agency over it directly, and your conscious experience would not be the same as that one. And so if I made a clone of myself, we would be arguing about who would be studying, because I mean, I don't think either of us would want to study over doing something fun, for example.
Yeah.
And so like that's why, I mean, in my presentation, and just the thought that I've had for a long time is in application to AI specifically, that's why I feel like narrow AI is probably the way to go. Because as cool as general AI is, a lot of these extensions of what we want to achieve within our lives are black boxed or bounded by a very clean set of just objectives that we want to fulfill. And so instead of making an instance of yourself that would study for you, just have like a module in your head that expands your memory infinitely, or able to process information and thoughts and emotions, all of that much greater to what we can currently do. I just don't agree with the understanding that if you had an exact carbon copy of yourself, that you could consciously experience what it would be consciously experiencing.
I wonder how quantum entanglement would play into this. Like, I was just thinking about it and I was like, okay, by the rules of quantum entanglement, you know, you have two particles, right? For example, like 2 electrons, and if one is entangled with another electron, if one is spin up, the other one's spin down, right? So then I was thinking, okay, maybe we're only going to be able to have 2 existing copies of ourselves that are entangled. But then I was like, we have multiple different particles in us, so it's like quantum computing. There's an infinite amount of combinations that could exist. So I mean, who can tell what the nature of how these multiple instances will work, how they will manifest themselves. And one thing I'll just say, like, just to what you said, Tian, about, you know, studying and working on like, you know, building our memory capacities using some sort of, you know, neurotech or something like that. I think the problem with that is because the problem is with education, because education emphasizes the information that's already in your head. Even when we all offload our memories into these things called phones and computers. So that technology already exists. It's just the education system limits our ability to make use of it. That's my one big gripe with the education system. On a whole other tangent now, ethically, like judging by like virtue ethics and things like that, would we only want certain people to make multiple instances of themselves? Like, would we have to ban people from making instances of themselves because they're just bad people and we don't need more of them?
I mean, with the use of this technology, then I mean, it applies to like atomic or any other really hyper changing technology out there, right? We don't want it to fall into the hands of people who would abuse it. I just think it's impossible to do so from a philosophical standpoint, that you could have another conscious experience or another conscious entity be of your own. Like, I just don't think it's possible. You can create another copy of yourself, but you don't have agency over what it would do in its life. So if you, let's say, cloned Hitler, but this Hitler was good at art and went to art school, then hey, look at that. You have a really good artist now, right? Like, you can't, I just don't believe you can make multiple instances of yourself in the way of expanding or adding on to your conscious experience. And so that technology, in my opinion, just wouldn't exist. You can make copies of people, right? Like, let's say cloning technology gets to that point and you can make clones of yourself ad infinitum. Well, then you would just have multiple, versions of yourself that would have very individual experiences, built off the same DNA. And let's say given a same or different environment, they would just be acting differently. And none of those experiences you would incorporate unless they like talk to you. For example, that people talking to each other is how they share their conscious experience. And so that is no different than what we currently do.
Yeah.
I wonder if there would be any sort of primacy that's given to the original person as a sort of cause of all these other
That's
copies.
another thing. Yeah, like I believe that when you make in the, I guess, in the conversation of making multiple instances, they would carry your memories, everything that you had up to that point of being instanced. They would know. So they would know about your birth. They would know about all the traumatic childhood memories you had, and they would just work from there. And so I guess in essence, you can't even distinguish the two, because they both are from the past knowing everything about you. And so they are as you would be. They would just act according to, again, the quantum rules of uncertainty.
Oh man, this is so uncanny, because this is actually relating to what I did for like a research paper for a course on Catholicism, of all things, about like how Catholics and Christians understand the Trinity. Like some of the philosophy surrounding that, like it goes like way deep into like time travel, and like how multiple instances can simultaneously be different but be one, right? Like how the Father, the Son, and the Holy Spirit are seen as one. And this is really surprising to me, because it just goes to show how these sort of heuristics from religion and whatever are still actually quite useful in even discussions of multiple instances of self.
So, if you just think about augmentation, like I'm aware, if you take mental illness in people who are at the really fringes of society and heavily impoverished and so on, and if you just fix everything in their environment, sometimes the mental illness just goes away. It was so related to that. So how does that relate to the influence of being augmented? If you think of a very evil person, a person with a bad personality, with a certain intellect level, right? And you augment that intellect threefold, they may instantly realize, I've been wrong, wow, I've really been wrong about stuff, right? And so it's not going to work 100% of the time. We don't know how many instances of this person instantly becoming like moral and balanced just by having greater intellect, but there will be some instances of that. So it'll be really interesting to see when being evil and really terrible person is a permanent state. No matter how smart you get, nothing fixes it, right? And when it's entirely based on your limited understanding of the world around you. And once that's improved, then the disorder just goes away. So this is something else that we will discover.
I wonder if it would be useful for people with limited intrinsic motivation, who already are at that base level where they don't have the motivation to or the energy to engage with the world, like would multiple instances of self be effective in sort of inspiring motivation? Would it be able to like surmount that barrier? Because I find that that's the biggest thing when we think of the future, because some of us just might not have the motivation to go through all these things, multiple instances
And
of self.
the strange thing about that, the you know, in my 74, almost 75 years, the instances of like failed human motivation are in very wealthy families, usually the younger children. Like, you know, they realize early on, wow, I really lucked into something here. You know, I live in a mansion and we get all this stuff and I don't have to accomplish anything or do anything. You know, I'll still have a great life, right? And like, it's so frustrating when you see that happen. And you know, strong efforts are made to keep it quiet that this one child, you know, is just so darn lazy and just not doing anything useful in the world when they have everything, right? And they just they seem to lack the motivation.
But isn't that the goal of transhumanism, for everyone to already have everything? So isn't that a good thing?
Yeah, no, it is, but we'll gradually figure this out, you know. There probably is a cure for those younger children in wealthy families who decide around puberty or something that they're not going to do anything for the rest of their lives, right? There's a cure for that, and we'll figure out what it is.
I suppose now in this context, it's seen as bad because, you know, you have someone at like what David Pierce is saying, at a higher base level of hedonism, right? While other people are so low. Like, I feel like that there's that inequality aspect that feeds into that not being good. But maybe if we're all at the same base level, then we'll rejoice in other people having great lives.
I wonder, because like a lot of people who are born into wealthier families who are just like, oh, I don't have to do shit to get what I want. I feel like they oftentimes fall into addictions, which is quite interesting because they're so bored and they're just like, oh, drugs. Sorry, I have dirt on my hands because I'm planting. Sorry, this is like very like, we're making a little like propagation station. Yeah, so I wonder, like, I was thinking about if transhumanism would lead to eradication of drugs because, or addictions, because like I was so focused on it being like a physical feeling with like the brain health, and like it's like a physical satisfaction along with like the mental. But yeah, I wonder if like with like mind uploading and like with other beings being able to like perform the same duties and stuff like that, like I wonder if that's going to lead to more addictions maybe. And like maybe we'll have, with like development of like new technology, like maybe we'll have like more sustainable ways where people can like be addicts. Like right now, like a lot of IV users, they're like one of my clients doesn't have any veins anymore that's alive or like considered alive where they can like inject, because like their veins have like just completely died from like the drug use. So I wonder if like technology is going to be somehow utilized that way. And it kind of makes me like concerned, but also really nice, because that means like doctors will continue to have jobs.
I mean, even, oh, sorry.
Oh no. And I like, just to really like quickly go back onto our alternative selves, like metaphysics, which is like the focus part of my like philosophy degree focus is in metaphysics. And it would say that if you like the same clone with like the same historical like experiences or like history is like standing next to you, then you're at a different temporal like the space isn't the same, so like you're a different person. But then I wonder if that's gonna be applied the same if we no longer have bodies. Like how would we calculate the space and time that we exist? And then it's like a whole new existential crisis to dive into.
Yeah, and people describe having a dial where you can dial up whatever feelings and sensations you want, but it's much wider than what we could ever experience now. Like there'll be whole new, emotional states that nobody's able to access now that will be possible then, and maybe unlimited, So it is kind of hard to figure out how will that turn out in the end then, So
Yeah, I was also thinking like these are just like my random before going to bed time, like brain rush thoughts. It's like, what if we could tune our bodies so that like breathing makes us high, or like feel like we're getting high, or like there's just like so many different ways outside of like utilizing, whether it be like lab made or like shed made drugs. Like we don't have to rely on those things to get a crave and like satisfaction we want. And maybe like that will lead a whole new way of addiction recovery treatments that's like more effective and like doesn't take a lifetime. But at the same time, I'm just like, what if without having to do anything, like what if people just want to like breathe and like that's all they do, and like that's like them wanting to like that's their life and like their goal, and like that's what they're addicted to, if like it somehow be able to like be altered to make themselves feel good.
Well, there will be a sort of ethos of the future, right? We don't know what it will be, but there will be a kind of way of living that people will respect and think, gee, you're doing that really well. And otherwise, they think you're a complete loser, right? And we don't know what those parameters are yet. What will determine that? It certainly won't be the job that you have, because probably hardly anybody will have jobs eventually. So it'll be other things that determine whether this new standard ethos of society, whether you're fulfilling it, exceeding it, or doing less well at it than anyone else, Yeah. And it's a new way when you meet somebody and get to know them, of figuring out whether they're sort of handling things better than you and you can learn from them, or they have a lot to learn from you, or so
yeah, that makes a lot of sense, because I feel like if we logically follow the kind of current paradigm we're in, it will probably end up leading to some kind of mega addicted state. Because I mean, right now we're already on TikTok. That algorithm's supposed to retain our attention. We're supposed to keep getting that hit of serotonin over and over and over again, and it's unscrollable. I mean, it's infinitely scrollable. That's almost like I can't even think of a more sophisticated social media engine.
No, you're absolutely right. Now you would appreciate that I don't know much about Instagram. I've only been on it since February 1st. But initially, when you join, you get this notification, you're all caught up when you've actually looked at everything you can look at that's on your feed, right? But very soon, that is no longer possible. You can't be all caught up. You could be spending like now I'm following 5,000 people and there's 1,600 people following me, right? So at that point, you would never be able to spend enough time with your phone to actually see everything that you would want to see. And most people are then in that state. So maybe they're thinking back to the point where they got this message, you're all caught up. Thinking, well, I want to see that again, even if I have to look at 2,000 pictures, So
it's bottomless.
Yeah.
One thing I'd say is, are there healthier addictions than others? Is it healthy to replace a heroin addiction with perhaps some, like a virtual reality addiction where you're, engaging and living in a VR? Like, are these addictions equivalent? And I
Well,
guess,
see, you could create something where you take a person with a terrible personality and they consent then to spend like months and months in this virtual reality game that constantly teaches them like a much better way to live, and the goal of the game is to make them a much better, more useful person that functions better in, society. So.
It's interesting. I don't know. I feel like in the future when like the costs of addiction, addiction viewed as bad mainly because of all the costs and all the negative side effects that come from it, no matter what it would be. If in the future those are all alleviated, the goal might not necessarily be like even in the notion of making bad things good, it's just what you decide to do. Like I know this is a very impartial view of the future, but I honestly think like if we don't have jobs anymore, if it's just up to us to basically realize ourselves in whatever way possible, the whole notion of morality kind of goes out the window as well. Like you would just have groups of people who vibe in a certain way essentially, and there wouldn't be like a good or a bad, as long as there's no like direct interrelational inference that would be like that somebody would impact another person on a solely individual level. There isn't really like a good or bad anymore. Like if they feel satisfaction in doing bad things the same way you do good, why wouldn't they be allowed to do so? It would just be in a better environment, I guess.
But you could create the sort of world you're talking about. You could create another world where the rewards for being good are much greater than they are now, and the penalties for being bad are much worse, right? So you're kind of shaping people into these in a certain definition of what's moral. You're making them much more moral than people are today, because that's simply how the system works. And you could create either one of those kinds of systems or something entirely.
Is it ethical to make people more moral based on your own
It
morals?
might be more evil than anything else you could do, right? Yeah, I don't know. I think it's 4 o'clock. It's probably
Yeah.
logical time to. So what I'm going to do is create 4 videos today. There'll be the 3 presentations, and then one just of this multiple instances of self-discussion. And you've probably all realized the way the videos work. It's much harder for me to edit it down to just the one talk. So the person who talks first, their video, actually, if you keep on watching it, is the entire session. But it gets the title of the first person talking. Then the second person, I'm starting with the beginning of the second presentation. It's just easier not to have to do that edit at the back. So it means like today, the video length of the first person presenting will be quite long, but probably nobody will actually watch it, because the latter part of it is not what the title says it is. And people say, oh, what the heck is that? And they'll stop watching, right? So anyway, that's just easier because I'm doing the editing, and also the file size of these Zoom videos is pretty tiny. So it isn't like we're ending up with huge files. They're usually like 1 gigabyte or a gigabyte and a half at the most. Whereas if you're shooting regular 4K video, you can end up with huge files, 100 gigabytes, something like that. So yeah, Anyway, so thank you for today, and we'll see you again on Tuesday. Have a great weekend, guys.
Oh God, I have so much dirt on my hands. Bye.
Bye bye.